Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Giving birth can be painful, and after birth, you may need to take pain medication. Today we'll be talking about everything you wanted to know about the pain medications you'll be offered after birth and whether you can take them while you're breastfeeding. So click those like and subscribe buttons and stay with us. To start with, it's important for you to understand what pain looks like after birth. Pain is normal, and we want to aim for you to have a pain of around a number 2. So what does that even mean? We use a scale that goes from 0 to 10. 0 is no pain, and 10 is the worst pain that you've ever felt. Normally, with a vaginal delivery, 1 to 2 is approximately what we're looking for and is considered normal pain. For a C-section, it's usually 2 to 3. When it's time and you think you need pain medication, please don't wait until you're a level 10. If you're a level 10, we're only going to be able to get you down to like a level 5 or 6. Instead, around 5 or 6 for both types of delivery is when you want to consider pain medication. There's a lot of different medications you may be offered. It's important to take them as directed. A very good example is Tylenol, which can severely affect the liver if you take too much, even in 24 hours. Ibuprofen can affect your kidneys, so you want to make sure you're taking it as directed. If you've been given a prescription pain medication, you want to make sure you don't take any over-the-counter products without asking your healthcare provider. Percocet, for example, also contains Tylenol in it, so if you take Tylenol over the counter and Percocet, you may take too much Tylenol in 24 hours, which could damage your liver. Finally, let's talk about the types of pain that you might feel. For both a vaginal and a cesarean section, you may feel cramping, kind of like menstrual cramps. That's the uterus contracting back down to prevent bleeding. Next, you may feel burning at your incision. This includes both an episiotomy or a normal tear during a vaginal delivery, as well as the C-section incision. For our C-section moms, sharp stabbing pains, very severe, are normal, and those are usually gas pains. Unfortunately, this is the scariest pain, and the best way to treat this is through movement. And finally, for our C-section moms, your belly may feel very sore, like you've done way too many sit-ups. This is because we manipulated your muscles and we cut through some of them during the surgery. After a cesarean section birth, or sometimes for a very traumatic vaginal birth, we will give opioids. Opioids are medications that usually have some form of a sedating effect. Percocet is the most common. It's Tylenol combined with codeine. Percocet tablets can be taken every 4 to 6 hours for pain as needed. It's very important that you don't take Tylenol with it, as you can have an overdose of Tylenol. Some of the side effects of most of the opioids include dizziness, fatigue, constipation, nausea and vomiting, and dry mouth. You may also receive IV medications right after surgery, including morphine and Dilaudid, as well as a type of morphine called Duramorph in your spinal or epidural. These are all safe for breastfeeding. However, you just want to keep an eye on your baby and make sure the baby isn't drowsy or having difficulty feeding or breathing. If you see any of these, you need to let your healthcare provider know. Tylenol is an over-the-counter pain medication and fever reducer that may be offered to you as a pain management option. It's also called acetaminophen or paracetamol. Usually, Tylenol has no side effects and it is safe for breastfeeding. It's great for headaches, fevers, and general pain. It's extremely important you take Tylenol as directed. The labels are very clear as to how much you can take in a 24-hour period. If you take too much, you may develop liver failure, which can happen in as little as 24 hours. Please remember to hit the like and subscribe buttons so you can get our latest content. Ibuprofen is part of a category of medications called NSAIDs, non-steroidal anti-inflammatory drugs. Other drugs in this category include Toradol and diclofenac. Other names for ibuprofen include Motrin and Advil. These medications are good for cramps and they're good for that muscle pain that you might feel. All of them are safe for breastfeeding. It's important for you to understand that these medications can cause stomach issues like nausea, vomiting, and diarrhea, so take them with food. And they can also cause stomach ulcers. Again, make sure you take them with food. We cannot give these medications to anyone who is experiencing kidney issues, already has stomach ulcers, may have clotting issues, gastric bypass, and high blood pressure. If you have any one of these conditions or develop them after birth, you need to let your healthcare provider so they can know so that they can prescribe a different medication. It's extremely important for us to address topical medications. Most people think that if you put something on your skin, it's not going to have any effects on your inside system or your baby. But that's not something you should think of at all. And this is why it's very important that if you're breastfeeding or pregnant, you talk to your healthcare provider about any over-the-counter products you're using. Topical lidocaine sprays are very commonly used after a vaginal delivery, especially if you have a natural tear or an episiotomy. There are no known side effects of this, but you don't want to overuse it. You also want to make sure that you wash your hands very carefully after you use it so there's no leftover lidocaine that you could accidentally transfer to your baby. Hemorrhoid creams and suppositories with hydrocortisone are commonly used for inflammation, and those are also safe. Witch hazel pads, which are also known as Tux pads, are used for inflammation and pain on the vaginal area, and you are able to use those with no issues. Finally, lanolin creams are often used for sore nipples. Now, I want to make sure that I'm clear. Lanolin cream, pure 100% lanolin cream, is safe. However, all of the other creams that we see over the counter, the nipple butters, the organic nipple creams, and the like, are actually not considered to be a great option for moms. This is because if you look at the back, they have a whole bunch of added ingredients, some of which are not actually safe for your baby, and some of which haven't even been looked at for safety. So try to stick with a lanolin cream that's 100% lanolin and nothing else. Finally, this topic is so important to new moms because they're worried about putting different substances into your body. I encourage you to take pain medication when you need it, but there are some natural remedies that you can use to try to help with pain without taking a medication. You can use ice packs on your perineum and vaginal area to help with pain and swelling. Sitz baths are often also extremely helpful. Stretching your body and getting massages can help loosen muscles and prevent cramps. Warm showers are extremely soothing and can loosen up those muscles. Getting plenty of sleep and rest, nutrition and hydration, all essential. And don't forget self-care. Self-care like going out and getting your favorite coffee or listening to your favorite podcast are essential for good health and can really go a long way to help your pain. I hope this video has helped you learn all about your options for pain management after birth. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content on pregnancy, labor, and early childhood parenting. Share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.